has not experienced it, never has fronted the media before, so I just ask you to be a bit kinder than you would be with me, if you don't mind. So let's start with the good news in terms of the results for the day. Up to 8 p.m. last night, we've had 12 new cases. Now, obviously, that's any cases are a concern, but 12 cases is positive, having in mind the tracing capacity that we have here in New South Wales, and also having in mind what is happening south of our border. 3 of those were household cases that were actually acquired in Victoria. 8 were locally acquired cases. 1 case was linked to the Thai Rock at Wetherill Park. 2 cases attended the Apollo restaurant in Potts Point, and 2 cases attended the Mounties at Mount Pritchard. And 3 are linked to people who attended Mounties. So we've had obviously considerable numbers related to the cluster at the Crossroads Hotel, to the Our Lady of Lebanon Church, and also to Potts Point Thai Rock, as well as the Apollo restaurant. But you've also got to remember that a number of these cases now are not just primary cases, they're secondary, tertiary and quaternary cases. But our tracers continue to do an excellent job keeping those cases well and truly managed, in the sense that once we know who they are, who they've been in contact with, we can ask them to go into isolation, self-isolation, and they have our response from New South Wales residents to requests for self-isolation has been very, very good. So I want to thank the community for that. That takes us now, of course, to 103 cases associated with the Thai Rock Wetherill cluster, but as I stressed, that's primary, secondary, tertiary and quaternary cases. So people who've family, friends of people who've been there or known people who've been there. 58 cases associated with the Crossroads Hotel cluster, and 40 associated with the funeral events in Bankstown, and 28 cases associated with the Potts Point cluster. I'm just going to emphasise this, that we really do rely on the community doing the best for the rest of the community and for themselves. The Premier's made the point that using masks in various situations is beneficial. And I'm just going to ask Dr. Chant to make some comments generally about how we can continue to keep ourselves safe, having in mind those circumstances. When Dr. Chant's finished that, then what I'll do is I'll talk a little bit about the airport, and we'll have Therese Anderson discuss what they're doing, and I'll ask the nurse, Sarah Nilsson, to have some commentary about that. Then I'll ask Assistant Commissioner Scott White just to make some commentary from a police perspective, because it's all a team out at the airport. So much of what we're doing here in New South Wales has been a team effort, not just police, not just health, but the community. And our community is generally acting to keep us all safe, and I want to thank them for that. So I'll ask Dr. Chant now to say a few words about those issues to do with the numbers to date and any other issues arising with regard to masks and so on. Dr. Chant.
Thank you, Minister. So we are at a critical point in our response to COVID-19. The objectives currently are twofold. One is to bring an end to the current chains of transmission that our detectives are tracking down, and that is by making sure that we detect those cases early and make sure that the contacts are isolated, and that will allow us to break those chains of transmission. We're also aiming to make sure that we can recognise any cases in the community that are occurring. So as yet, unrecognised chains of transmission can be broken. And for that, I need the assistance of the community. I need you to come forward if you have any symptoms, however mild, that scratchy, itchy throat, that mild cough. Please stay home, get tested, and stay home until you've got those results. I would also like to urge the community to regularly look at our website, which has a list of the venues where infectious cases have been. There is specific advice for some venues where we're asking you to self-isolate for 14 days, get tested, and irrespective of your test, remain in isolation for 14 days. In others, we're just highlighting that an infectious case was there. In some settings, we think the risk was very low, but at the moment we're taking a very precautionary approach. We want to make that information available to the community, and in those circumstances we're asking you to monitor for symptoms and get tested should any symptoms occur. In general, everyone has a role to play in our response: business, government, and most importantly, members of the community. At this moment, it is critical that you maintain your social distancing, that 1.5 metres distance, and also that you wear a mask if you're going into situations where you're not going to be able to maintain that 1.5. And we're particularly focusing on the risks associated with indoor environments, enclosed environments. So if you know that your bus is going to be crowded, if you know you're going into a shopping site that is very crowded, we ask you to wear a mask in those settings. I should also like to say that business has a role to play as well, and we're pleased to see that business is really stepping up, ensuring those hand hygiene products are available at the entrance to stores, make sure that they display how many people can safely go into stores. This is all about preventing COVID transmission, and we all have a role to play. So thank you very much.
Thanks very much, Kerry. We'll do questions at the end if that's all right. So I'll ask Therese Anderson, the Chief Executive of the Sydney Local Health District, just to give us a bit of background in a moment about the health hotels, the various structure or facilities that we have for people coming in from Victoria. Can I just say this though? The short message to Victorians is you shouldn't be coming to New South Wales unless you have a particular permit entitlement. So, and if you do come to New South Wales, you will be assessed by our health staff at the front line at the airport, and we have meeting each flight around about 9 to 12 health staff there, nurses, assistants in nursing, administrative staff working also with the police who are backing them in on this task. And some people will be able to enter, but it can be quite an onerous process because our health staff are doing a fantastic job. But I don't want to take Sarah's thunder on that, so Sarah can explain that to you, but quite amazing the level of examination that goes on in the process as a flight arrives and as people get off the plane. What I will ask the Chief Executive though is to tell us about what the Sydney Local Health District set up and the sort of circumstances in which people might go into those particular health facilities from Victoria. I know there's been some commentary today about why don't we have quarantine in the same way we have for international travellers. Obviously that was set up for a reason, and that is we need all international travellers to be able to be managed here, and we've done that very successfully now over some months. But what we are finding with most of our visitors into our state, if you're asked to, or returning travellers, if they're asked to self-isolate, they do. We've had incredibly good compliance, but if there's a necessity, as I'll let Therese Anderson explain, there is effectively a quarantine that can occur, and I'll ask her now to just address you on that. So Therese Anderson, the Chief Executive of the Sydney Local Health District. Therese.
Thank you. Thanks, Minister. New South Wales Health, through Sydney Local Health District, established the Special Health Quarantine accommodation in March, initially for people who were unable to self-isolate at home, people in the community who were COVID positive, who needed to self-isolate. We then extended that to international travellers. We were asked at the end of March to work with New South Wales Police and the SHIOC to establish the special health accommodation to support international travellers who had been returning, who'd been overseas in the previous 14 days. In partnership with South East Sydney, we have been screening at the international airport, and anyone who has been symptomatic has been swabbed and taken by patient transport to the special health accommodation where they stay for 14 days. When the hotspots started to occur within Victoria, on the 2nd of July, we commenced screening at the domestic airport. And again, with a risk assessment approach, we have taken people who have been symptomatic, who are not entering New South Wales with a valid permit into the special health accommodation. And again, transport occurs through our patient transport services. We are very proud of the model that we've developed in partnership with New South Wales Police. We believe New South Wales Health has de-risked our returning citizens and we are doing the same approach with Victorian citizens. So when people are coming from Victoria, they are screened at the airport, and Sarah Jane will go through that process with you. We assess them, and then on a risk management basis with our clinicians, we determine whether or not they are safe to return to their homes, where they are contacted on a regular basis during their period of self-isolation, or if they require accommodation in the special health accommodation, they are taken to the special health accommodation by patient transport services. We believe that this risk management approach to our patients has been a very positive thing for the people of New South Wales, and we are very grateful to the people of New South Wales for listening to the Premier and the Minister and the Chief Health Officer around those very special messages around self-isolating if you are symptomatic, being screened if you are symptomatic or from a hotspot, and making sure that we all socially distance. Thank you.
Thanks very much, Therese. So I'll ask Health Commander now. Obviously, Sarah's a nurse, but she's held a number of very senior positions, and she's now the Health Commander at the airport. There is a process of escalation which she can talk about in terms of any particular issues that come up. If she identifies somebody who needs a particular consideration, then she can do that process. But she can explain that to you now. I've asked her if she can just take us through what happens when a flight is arriving. And there are, by the way, I'm seeing some media reports, I'm not that they'd be inaccurate, of course, but there's about 17 flights a day. No, there's about 3 to 4 at the moment. But the health team is meeting them all and doing what they need to do, backed up by New South Wales Police. So I'll ask Sarah Nielsen, our Health Commander, to come up to the microphone for her first time and just take us through, Sarah, if you can stand right here close to the mics.
Sure. Yep.
And maybe watch Tash over there,
Okay.
and just take us through what happens when a flight arrives. Over to you.
Sure. So before a flight arrives, we actually get in position with all of our PPE and make sure that we have the New South Wales Police there to support us. After we are ready and in position and have all our protection on, we then call the operations centre at the airport to let them know that we are ready for the flight to come into the gate. As the passengers disembark, we have the airport staff, the airline staff ask whether if anyone that doesn't have a mask on can put one on. They then come through to one of our nurses who will check their temperature and check if they have had any symptoms. If they clear that process, they then move forward to our stage 2 process, which is where we collect a passenger information form which has all of their details, including the flight, their seat number, their personal details, so their name, their date of birth, their address where they were in Victoria, and their address where they're intending to stay in New South Wales. When we get all that information, we cross-check that against a formal piece of evidence, so it might be a New South Wales driver's licence. If they don't have a formal piece of identification, we would then need to confirm this with the police with their assistance. Anyone who we can't confirm their identification would be escalated, and we would not be letting through until we were satisfied that we had the correct details. We then go to the permit and see what permit they have applied for and check that it is the correct one. So for people that are transiting, we would ensure that we have their connecting flight details. And if they are transiting to an international flight in the next day or two, we also get their hotel details and confirm that through a booking. If they can't give us a booking, we would call the hotel and confirm that they are actually staying at the hotel address that they have given us. Anyone that comes through on a critical workers permit, it is checked. We do thoroughly check that they are indeed a critical worker and that that service couldn't be provided by someone already in New South Wales. If there are any concerns, we do have an escalation pathway where we can escalate to our disaster manager, and also he can then forward that on to the Ministry of Health. For any ones where we have concerns, we will have a teleconference with the disaster manager and a representative from the Ministry of Health to confirm any details that we need to make a decision on whether they would be allowed entry or not. Every single step is checked. Every single step needs to be thoroughly checked at the first stage. We then have our final stage for checking. At the final stage, this is where we deliver the public health orders, and we ensure that we have senior staff that have been at the airport regularly that are on that stage. They will then cross-check all of that information again. Once we're satisfied that their criteria for their permit is correct and it's met, we will then issue them a public health order, some information about hand hygiene, how to wear a mask. We will give them information about travelling home, making sure that they understand they cannot catch public transport home. After we have given all that information, we keep their passenger information sheet, and all of that data is kept and sent to the appropriate public health unit. I think that's it.
Can we go to questions in a minute? Is that all right? Just hang on. Could I ask a question though? Could you just explain the examples of where you might have had somebody who was a critical worker,
Yes.
they have a permit, or they don't have a correct permit? What have you done, and have any people been turned around?
Yes,
So if you could
yes,
just explain
okay,
that.
so yes. So for the critical workers, if they have a critical worker permit but it doesn't actually meet the criteria, we do escalate that. The process for us is that anyone who comes to New South Wales and they have not come through on the correct permit, they will then be swabbed at the airport by one of our nurses. And that swab will be sent off for testing. They will then be sent to one of our special health accommodation hotels to wait for the results of that test, and then further decisions are made there. If it is a critical worker that is permitted through, they can come through, but like I said, we do check everything. Obviously, all these details are escalated to our senior management at in the disaster unit as well.
Okay, thanks very much. Now, I'll ask, while all this is going on at the airport with our health staff, we also have the fabulous backup of our New South Wales Police, who have been incredible, providing staff there to back in the nursing staff. And of course, that gives a very clear message that if you want to get through the New South Wales border, you've got to first of all get through the health issues, then you've got to get through the legal issues if you've actually tried to be a bit slippery, and we have had a few people being a bit slippery. So I'm going to ask the Assistant Commissioner, Scott White, to just make some comments about what the police team do at the airport. Assistant Commissioner.
Thank you. The domestic airport forms part of our broader border control operation. Currently we have a number of police operating out of the domestic airport in conjunction with health. The process is you require a permit to enter New South Wales. And as the Minister said, if you do not have a permit, do not come. The simple fact is they arrive at the airport, health conducts screening, validity is checked of permits. Those that don't comply are turned around. We have turned people around. Again, on the border, we turned 20 vehicles around the last 24 hours. Again, I reiterate, if you do not have a permit, do not come to New South Wales. The other aspect of this operation is compliance. To date, we've conducted over 23,000 compliance checks on isolation. We've conducted over 54,000 business inspections, and in the last 24 hours alone, we've conducted over 300 isolation compliance checks. Thank you.
So Sarah has said she's happy to take questions. As James was getting enthusiastic, I'll ask Sarah to come back. Be nice, James.
Sarah, this seems like quite an extensive process at the airport. How long do all of these stages take when someone gets off the plane and then they're allowed to go? And how many people each day are coming in from Melbourne?
So the numbers have varied significantly. It's very hard to say specifically how many numbers. I'm sorry. It would be possibly between 100 to 200 each day. So, sorry, can you repeat the other part of the question?
I would like to know what those people are doing.
Yes, the process time. Sure.
Why they're coming in, how long?
Yeah, okay, so the processing time, we don't rush. We take our time and make sure everything is thorough. Obviously, people can go to the bathroom because it can be a lengthy process, so we'll have police or health escort them to the bathroom if they need to. The process, if they have a an appropriate permit and it meets all of the requirements, that process shouldn't, dealing with us shouldn't take longer than 20 minutes, provided they have all their documentation. But if we need to confer, it can take a lot longer. Given that that's 20 minutes with that person, but if there's 80 people on the flight, you know, we don't have one person per passenger. So sometimes the processing time for the flight can take maybe at least an hour onwards. Mm-hmm. So we give very specific instructions that they need to handle their own luggage, that they need to sit in the back seat with the windows down. If there's 4 people they can't fit in an Uber, and we explain that to them, they would need to get 2 separate Ubers or taxis. And we remind them about hand hygiene. We check that they have a mask for that travel in the taxi or the Uber, and we also check that they know how to fit the mask. If we can see that they've got their mask down under their nose or anything like that, we would give them a reminder, and we also give them the information sheet on how to check that a mask is fitting correctly.